Welcome, everyone. Thank you for joining our DNP information session for Frontier Nursing University. My name is Dr. Kara Jefferson, and I am the DNP Program Director, and I'm also joined by Dr. Kimberly Couch, who will also be here answering questions with me. So our mission here at Frontier is to provide accessible nurse midwifery and nurse practitioner education that integrates the principles of diversity, equity, and inclusion. We transform healthcare by preparing innovative, ethical, compassionate, and entrepreneurial leaders to work with all people with an emphasis on rural and underserved communities. So the reason that we have our mission statement here is because it is important, number one, because it's at the center of everything we do, but there are also keywords that I like for people to pay attention to. And those words are innovative, compassionate, entrepreneurial, ethical, rural and diverse communities, as well as diversity, equity, and inclusion. These things encompass who we are as an organization and who we want our DNP scholars to be when they leave here. When you leave here, you can do all of the things because you will have the resources to be able to do that. So during this session today, we will cover why Frontier. Why should you even get a DNP as opposed to a PhD or a doctorate in midwifery or an educational doctorate? We'll talk about the programs of study, our admissions criteria. We'll talk a general overview of the DNP project, how to get started, and a little bit about what we do in our DNP professional advising for the project. So, as you already know, Frontier is a distance education program for our DNP, well, for all of our programs. And at Frontier, we have something called the culture of caring, which we firmly believe in. Our culture of caring has 5 elements, but the gist of it is that we care about you and you care about us, and we're going to treat each other with mutual respect in all of our communications. The great thing about distance education is that your home community becomes your classroom. So it actually doesn't matter if you're working at your kitchen table or if you're working on your patio. As long as you have a stable internet connection, you can seem to get your work done from anywhere. And the great part, you can study from your home. You're not having to get in your car and travel down to an educational building to go to course, to go to class and do all of that. Keeping in mind that organization is going to be one of the key pieces of you being successful in a doctoral program, because when you are working from home and doing schoolwork from home, it is very easy to get distracted by all the other things that we have going on in our house. But you can study anytime. Our courses in the DNP are mostly asynchronous, meaning you can do this work on your own whenever you have time. But there are courses where you will have synchronous work. So you may have to join synchronous live learning sessions. But we let you know all of those things in advance so that nothing is ever a surprise to you. We also do something a little bit different here at Frontier that maybe not all of the schools that you've gone to for your other programs have done. And that thing is called Bound. And in our Bound sessions, we tend to have you come to Versailles, Kentucky. That's where our campus is located for our orientation session. That orientation session is different depending on if you are a companion student, meaning you have attended one of Frontier's master's programs or PGC programs in the past, postgraduate certificate, or if you are coming to Frontier brand new as a postmaster's student. So if you have been enrolled at Frontier in the past 2 years, you would be eligible for our companion 1-day virtual bound session. If not, you come on campus for 3 days, and it is a great experience, and every student who has come actually loves it because it is a chance for you to feel connected, ready, and inspired to begin your DNP program, but also connected to those other people who will be starting out the cohort with you. So I just mentioned that we are located in Versailles, Kentucky, And here you have a few pictures of our campus. The bottom right is just the sign that you see when you're walking in, and the top left, the far left top, is a picture of what the student lodges look like that students stay in when they come. So we give you this orientation to the whole campus when you come. So I'm not going to explain what every building is to you, but just know that it is a great, great campus. Very beautiful. And so I would be remiss if I did not talk about all of the things that Frontier has managed to achieve over the years. We know how to do distance education well because we have over 100 or almost 100 years of experience in nurse midwifery and nurse practitioner education. We have students and alumni that represent every state in the United States, but that's not even including all of our current students or alumni that live internationally. We have had over 9,000 graduates from all of our programs. And like I said, we have been doing distance education for a long time. We've also received several other awards. We have received the Higher Education Excellence in Diversity Award, which is our HEED award, and we have done that 7 times. We have had 4 consecutive years being named one of the great colleges to work for. We received the AACN 2023 Award for Inclusive Excellence, Belonging, and Sustainability in Nursing Education, which is huge because we want all of our students to feel like they belong and feel included in some of the decisions we're making at the university level. But we've also been named an academic honoree for the 2024 Healthy Work Environment Award presented by Sigma. So another great thing. So you heard all about us and all the great things that we have managed to achieve in some of the years, but what do you actually get out of this? Well, one of the things that you get a ton of at Frontier is student support. We pride ourselves on the amount of support that we are constantly offering to our students, and it comes in a variety of ways. We have online student groups. We have students that get together for student support. Sometimes students in a cohort create Facebook groups or even text message threads where they provide encouragement throughout the term or throughout their whole program. We also have faculty that serve as mentors to several students because students are also allowed to serve on committees if they are part of our if they're part of our student, their student representative. Financial aid is huge. I know lots of people always have questions about financial aid in these sessions, but we do have financial aid advisors who are here to answer your questions about any of your financial needs, including questions you may have. Our library is completely online. We have the best librarians. They know all things library science, and they are actually very instrumental in helping our DNP students all throughout their didactic courses, but then also again in their project when they need to really hone down deep into the literature. We have a diversity, equity, and inclusion office that also offers student interest groups. So for example, there's a neurodivergent student interest group. There's a students of color interest group. There's a men in nursing interest group. So there's a whole bunch of different interest groups that you can join. And again, the reason we do all of this is because we want you to feel included in the Frontier community, but also connected, not only to your instructors, but also to staff and other faculty. And one of the things that we do every year, we have a diversity impact conference that you welcome as a Frontier Nursing University student. So here are a few pictures of what that support team kind of looks like. So you see me, Dr. Kara Jefferson. I'm the director of the DNP program, but you also have a variety of course coordinators and course faculty. There are academic advisors, financial aid officers, credentialing coordinators, and of course our IT specialists. And so we also have IT that is available to you during the week. They have dedicated hours. So if you run into any technical challenges, they are here to be a resource to you. So now let's switch focus for a little bit And so why should you get a DNP? And I guess even more important than that, why should I get a DNP instead of one of the other terminal doctorates that there is out there? We at Frontier only offer a DNP because a DNP is currently a clinical doctorate, which means that if you are any kind of nurse practitioner or nurse midwife and you are working in a clinical setting, this can benefit you in so many ways. The DNP makes you an expert on a particular topic, but even more than that, even though we don't label our DNP as a DNP in executive leadership or a DNP in health policy, we are very strategic at not doing that. We're doing that for a purpose. Because in our program, you get all of those skills. You get leadership courses. You actually get a nurses educator course. You get a health policy course. You really hone in on evidence-based practices. So we consider our program to be a very well-rounded program. And if you ask any of the people who have gone through our program before, they will tell you that they feel well equipped to take next level leadership jobs as a result of getting their DNP with us. In the past, there have always been questions about, well, I am a midwife, so there are some programs that offer a doctorate in midwifery. And yes, I would say if you're interested in that, it's a possibility for you. But at the same time, it is also very limiting. If you decide that you're not going to stay in midwifery for your whole career, we know that currently, if you look at the data, the average practice time of a midwife is about 8 years. And so then what happens for the rest of your career? A DNP is more of an umbrella clinical doctorate, so it kind of covers you and covers a good bit of what the doctorate in midwifery would cover you with anyway. A PhD is also different from a DNP in that both are terminal degrees, but our focus is different. In our DNP, the focus is on quality improvement, whereas a PhD, the focus is on research. And I make this distinction because we always have students who come into the program and they are like, I want to do research on blah, blah, blah. And that's great, but we are not a research program. And so if you are dedicated to spend the rest of your life researching one topic and then expanding on that research over and over, then maybe a PhD is better for you. But if you want to learn how to improve change where you are doing what you're currently doing right now, or taking it to the next level, then a DNP is for you. We know that it takes an average of 17 years to implement new knowledge into clinical practice. That, my friends, is a very, very huge gap. We shouldn't be implementing stuff 17 years from now when we know what best practices are now. We should all be doing that today. And the DNP degree allows you to go into your clinic or whatever hospital system you're working in and implement those changes now and test them and see if they work. And if they don't, you try something different. So you develop that expertise to lead and improve care for your patients in real time. And as I said before, it's a terminal degree. So let's talk a little bit about some of our admissions criteria and the requirements. You have to hold a master's degree in order to be eligible for our DNP program. Doesn't matter if it's a master's of science in nursing, master's in nursing, doesn't matter. It just has to be a master's degree in a nursing or related field. You must also have a current active registered nurse license in the United States with no encumbrances. This does not mean that your RN license has to be in Kentucky. It can be whatever state you are currently living. You also must have national certification as a nurse practitioner or nurse midwife. And your grade point average must be at least 3.0 or higher, and you must be able to successfully pass a background check. So I think these are pretty standard for most universities. Our program of study is the postmaster's program of study. We no longer have a separate companion program of study for those of you who may be asking, but our entire program of study is 30 credits. It takes about 8 18 months or 6 terms to complete. Our terms are 11 weeks of active student engagement, and then students have 2 weeks off in between terms to rejuvenate, spend time with family, do the things that you love, just taking a break from school because it is needed to keep you resilient and keep your eye on the prize. If you had to go straight through, I think it would just burn a whole bunch of people out. You will also notice that there is an asterisk next to study. And the reason is our programs of study are subject to change. We are constantly looking at how we can make these better so that they are most reflective of what's going on. So one of the things that I'll say here is, yes, this is our program of study. It does not mean that you must follow the program of study to the law. We do allow some variation that once you're accepted into the program. And I think it's important to mention because a whole bunch of people come into this like, I have to rush through my DNP program to get it over with. When the reality is, I actually don't want you to rush through it. I want you to take your time and absorb the information so that you can actually be a better clinician and a better leader and truly impact better care in your community. The last time I looked at DNP data, I can tell you that our DNP students are actually spending about 21 months. That is the average time of completion with our current students right now, because they actually want to spend more time with their family or friends or whatever it is that they have going on. So I just think that it's important that you know that there is some flexibility in this. We have 6 DNP didactic courses. They are listed right here for you. I mentioned some of them earlier. We have Nurses Educator, Fundamentals of Business and Finance and Advancing Healthcare, Population Health, Ethics and Health Policy, Advanced Evidence-Based Practice in Nursing, and Leadership and Organizational Dynamics. And so 3 of these courses you will notice also have an asterisk next to them. And that is because if you attended Frontier in the past for an MSN or PGC degree, you may have taken one of these courses, PC 713, PC 702, or PC 718. If you have taken one of these courses in the past, after 2014, we are currently accepting those on your transcript as we announced 2 years ago, only until the end of 2025. And so you will not have to redo those courses if you've already taken them, only until the end of 2025. After 2025, you will have to retake them because our curriculum it changes. And so we have to update it to make sure that it is the most current that there is out there. We also have what I like to consider the 4 DNP project courses. Even though they're all listed as separate individual courses, we as faculty like to think about these as one huge course because they all flow into each other. And so you can't take DNP 851 without taking DNP 850, which is the project preparation class immediately in the term before. There's subtle nuances that you'll learn more once you're accepted into the program. I promise you, when you come to your bound orientation session, we talk about all of this at length. So I don't want to go into the nitty-gritty of all of it today, but know that these courses are one course a term. So the project courses, if you're taking them as directed in succession, they will take you about a year to get through. We do have requirements. Your DNP project can be conducted at the place in which you work if they approve you for that. But we like to be realistic and kind of give you the hourly breakdown of how much time this is going to take you. So in DNP 851, the project planning class, you should expect to spend at least 3 days a week on site. In implementation, another 3 days a week on site. And then in dissemination, the only on-site requirement at this moment is your final presentation. So like I said, all of this is subject to change by the time you get into the program, because we're in the business of quality improvement. We're quality improvement experts. We tend to make changes that improve our program based on student feedback. So, what are the other important things that you need to know? Well, our upcoming application deadline is January 8th, 2025 for coursework that begins spring 2025, which is April the 7th. The next deadline after that is April the 2nd for coursework that begins for our summer 2025 term. And the reason these deadlines are so important is because we currently have what we call rolling admissions, which means the sooner you submit your completed application, notice I said completed, the sooner you submit your completed application, the sooner we can consider you for admission. If you wait until closer to that deadline, we may have already or mostly filled up the cohorts. So I encourage everyone to submit your application as early on in the process as possible. There is a little bit of grunt work that you will have to do in order to make sure that your application is actually ready. One of the things is you go on the portal and you submit an application, but it doesn't stop there. You also have to submit a copy of your current CV or resume. And so I'll stop right here just to talk about that for one quick second. Remember, this is a little bit like you applying to a job. You always want to put your best foot forward. So I encourage you, look at your resume or CV. Make sure there are no big glaring spelling mistakes, grammar mistakes, because those are the things that we are really looking at. Remember, this is doctoral level. And so we know that you're not at the end of the program, you're just beginning, but details do matter. And we want you to start paying attention to that because as a leader, these things become really important. The same thing is true of your essay. When you write your essay, make sure that you read it all over, use some kind of word processing program to make sure you don't have any big spelling or grammar mistakes. Read it aloud, read it to somebody else. There's a whole bunch of things that you should be doing with regard to that. But what we don't want you to do is use an AI software to write your essays. We can tell when essays sound robotic because they just do. And all of our essays are based upon you reflecting on experiences in your life and applying the DNP or just the essentials to them. And any robot program can't do that for you. It can't feel for you. It can't think for you. So be mindful of that. Also, back to your resume or CV. I forgot an important detail. You want to put all of your accomplishments, as many as you can, on there. So for example, if you've presented at a national or local conference, make sure that's on there. If you write for some journal, make sure you put that on there. If you're doing community service activities, make sure you put all of that on there because those are a reflection of you and things that you've done in the past, and they help make you stand out against somebody else. We are also going to ask you for professional reference requests. Honestly, people like to submit people who they think that they're absolutely fabulous, right? Because that's what we want. But honestly, the most valuable references are people who can speak to you because they have worked with you directly. So in thinking about who these people might be, it might be your supervisor, somebody who you work with closely right now. If you're, as an APRN, it could be if you have a collaborating or supervising physician, it could be that person. It could be your lead advanced practice provider. There's a number of people, but like I said, the most valuable references come from the people who know you the best that have worked with you at some point. And then, of course, we'll ask you to submit your transcripts, which is pretty standard for any school's application process. Our current tuition is about $685 per credit hour. This makes us one of the most affordable DNP programs there are out there. And like I mentioned already, we have our DNP Bound experience, which is our 3 days on campus where you come to meet faculty, meet staff, set up your schedule, and we just really get to know each other. You have your 6 didactic courses, your 4 project courses, And so we just have an overall great program that we're proud of. So how do you begin the DNP? There are currently actually, this is incorrect, and this is my fault because I forgot to take that out. There's currently only one method of entering the DNP, and that is through our standard admission process. So I have just made myself a mental note to go back in here and change this. We used to have a direct admission process for our currently enrolled MSN and PGC students. We no longer have that. Everyone is starting on the same playing field effective this last term. So you will have to go in, complete all of the applications, and then we get started. So if you have any questions, please scan this QR code or visit frontier.edu/follow-up to answer a few questions about this session and submit any additional questions regarding the program. You can also feel free to ask questions in the program chat. And I will take questions if anybody has them. Dr. Couch, are you here? Do you see any questions?
No questions in the chat box.
I have a question. I'm sorry.
Perfect.
Yes, my question. So going back to like you guys no longer accepting students who are currently admitted as in the MSN program. So that means if we can't, even if we apply before the term ends, we still can't get the recognition. We have to wait till the following term, or
So the companion direct admission process went away actually before our fall 2024 term began. So that means that if you are a companion student and you're interested in applying for our DNP program, you actually have to take your boards first, because part of your application process requires that you have completed your certification exam, because you'll have to submit proof of that when you apply. Does that answer your question?
yes, okay. So technically, even if I did, I can't pretty much apply until I have to do the standard application once I've
Yes.
finished my board. Okay.
Yes.
All right.
Yes.
Thank you.
You're welcome.
All right.
Any other questions? Let's see what's in the chat. Okay, no questions. So we'll have another point where we can answer questions too. So just a little bit about your project. And I'm only showing you this so that you understand a little bit about how we help guide you, because in the past, historically, all incoming students have so many questions about what is the DNP project? How does that look? All of those nuances. And I promise that when you come into the program, you will have a great idea, because we cover this in detail during our bound sessions. So during our project, what happens is once you get into the DNP 850 course, which Dr. Couch is course coordinator of, she will assign you a project faculty, and they do individualized counseling and give you feedback on your project. It's all about setting expectations about what you're expected to do during the term, as far as getting ready, getting a site, getting a project topic gap. That's what this course is about. It's also about ensuring that you are fully aware of your project site's requirements. Do they have any additional paperwork that you'll have to complete? Do they require that you have to go through IRB? We also talk about your program of study. Is this the right time for you to be doing the project? Do you need to take an extra term before you actually do the project? These are all the things that go into that meeting, because we never want students to feel like you're flailing out here alone and you just have no clue, which is why we have this course in place. So Dr. Couch is a great resource when we get to that point. But just know that as you come into our program, you do not need to know what your project gap will be. It is something that we discuss with you as you get into it and along the way. So if I had asked people what they wanted, they would have said faster horses. And the reason that we have this in here is just to show you that a long time ago, people never imagined what they actually would, like, they didn't think about the possibilities, but Henry Ford did. And so instead of giving people faster horses, he actually gave people a car. And the same thing is kind of true with your DNP degree. Right now, you may not know what it is or what you actually want to do with it, but we're asking you to trust us and to imagine the possibilities of where your career can go when you get that DNP degree. And so as you plan ahead, we ask you to consider a few things. One of those being, do I have a potential clinical site? Because if you're coming into our program, you know, you want to ask yourself, are you working? If so, your job should always be the first site that you consider to be your site for your DNP project. You do not have to implement your DNP project as an APRN. You can implement your DNP project in the RN role if you choose. You can volunteer at a site, but if you're also working because you have to support your family and volunteering, it can be quite a challenge. So think about how you want your life to be as you're going through your DNP program, because it's important, not only to your success, but also to our success. You also have to consider when you'll be starting a job as an advanced practice nurse. Transitioning from your RN role to an APRN role, it has its challenges. Some of you may take a job at one of the sites that you just completed your MSN clinicals, but there's still an onboarding period of time that you'll have. But even more than that, there's something to be said about being comfortable in who you are as a provider before you jump right in trying to lead a project and a team that you're not quite familiar with. So we like to be very intentional and thoughtful when thinking about this. And then you also want to think about what's happening in your life. Do you anticipate any major life challenges, growing your family, caregiving for a loved one? All of these things help to impact the program of study as you consider when you start the timing of your DNP program. And then again, like I said, we talk a lot about this when you come to DNP Bound. And then what other responsibilities do you have at home, at work, all of the things. And so I use this opportunity to spotlight one of our alumni, Stephanie Mitchell. Stephanie was in our DNP program at one point. Stephanie has been fighting in Alabama to open up a birth center that would be the first birth center in the state of Alabama. She is trying to renovate a historic landmark as the birth center. And I think that it's important for you to know, because as Stephanie came into her DNP program, this was actually not her big goal. Her big goal was to just finish her DNP program and get through it. But not only did she get through the program, it allowed her to see all the possibilities there were and how she could impact lives in a different way. And so here we are doing just that. So the distance between who I am and who I want to be is separated only by my actions and words. So there are a lot of people out there who say that they want a terminal degree. And there are a lot of people out there who say that they want a DNP and they want to start their DNP on this date and this time, and they want to finish by this date and this time. But not everybody is successful, because your actions and words have to be congruent. And when they're not, it generally leads to a problem in the process. So you have to be clear on what exactly it is that you want and what you want your life to look like in order for you to feel really successful. We know that you can do it. There will be obstacles. There will be doubters. There will be a lot of people who will tell you, why are you doing this DNP? It is not required for XYZ role that you want to take. You have to be prepared for that. Please know that we are all perfectly imperfect. And you have to be okay with that. There's no such thing as perfection. You will make mistakes. There's no doubt about that in my mind. But if you work hard, there are no limits to what you can do and how successful you can be in our DNP program and beyond. So success doesn't come to you. You go to it. And if you have any questions about financial aid, please feel free to contact the financial aid email address listed here. And if you have questions about our admissions process, please contact FNU admissions at frontier.edu. I will now stop screen sharing and take any additional questions you may have. Dr. Couch, any?
Yeah, Cara, there was a great question in the chat box about the extra hours that would be needed for the clinical hours. What activities are included or allowed? I work full-time and trying to plan a schedule at work. Well, what the DNP project is designed for is for you to improve the things that are going on at work. And so in one of your courses, you're going to collect the baseline data to determine how well you're doing or not doing at something, the thing that you want to improve. And then when you do implement your project, it is directly in your workday with the patients that you're seeing that day, and for the day, all the days of the 8 weeks. And we begin to change your behaviors, change the way that you approach patient care or engagement or screening, whatever it's going to be, to see if you're doing a better job at it, or your whole clinic or your hospital, whatever we're going to be looking at. So you don't need to plan for more clinic time as long as you've met those clinic hours that Dr. Jefferson talked about initially, the 3 days a week, because you will have extra assignments, though, that you have to submit, but those are not done during work days. Those are done after, and they're like any other program. You have to work, you have to do schoolwork in the evenings, on the weekends. Does that help?
Yeah, and I think the other thing to add to that is, there are employers, because sometimes students try to collect all of their data and do everything while they're on the clock as a provider in an office. Please know that while we count your time doing those activities as part of your clinical hours, you will have to be collecting that data outside of your patient care hours. So for example, if you work Monday through Friday, 8 to 5, well, you may have to go in an hour early or stay an hour later or both to make sure that you have just all of the data that you need. Some people are able to access charts from their home, but again, I can't promise that for every site. Everything is site dependent. So part of when you get into that DNP 850 course, part of what Dr. Couch teaches you is that you have to get to know your site. You can't just rely on what your manager says. You have to know the organizational structure, who is the best person to talk to, who is going to answer all of these questions for me. And so it's really learning, because one of the things we have learned is, even though some people have been working at their sites for 5 years, 10 years, 15 years, they have no idea who the key stakeholders are that they should be talking to are. So it's a really good lesson on how you should be able to function in these tiers of leadership.
All right, another question, and this one is from Caroline, who asked, will you be sharing your PowerPoint?
That is a great question. Quincy, do you know if we share this PowerPoint?
Yes, we will be sharing the recording with everyone who RSVP'd for the session. And if you didn't, I'll put my email in the chat and you can email me and I'll send it to you.
Perfect. So we share the recording. We don't share the slides, Caroline. Caroline, I hope I pronounced your name right. Some people say Carolyn, some people say Caroline. So Aza, hope I'm pronouncing your name correctly, says, if I decided to keep working as an RN after boards, can I do my project, or do I have to do my project only when working as a CNM? So this is a great question. You can do your project as an RN, but we will only accept you into the program once you have completed your board. So if you've taken your CNM boards and you've passed your CNM boards, you don't have to be actively working as a CNM or a nurse practitioner but you can still do your project on the floor where you're an RN or wherever you're working as an RN. And yes, you can still continue to ask all the questions. We get those questions answered, you know, as you guys send them. And you can always, if your questions are really more specific, you can, of course, always email me with any additional questions. Anything else? If so, this will be on record as the shortest session I've ever done, because generally the questions that I have take me over time. So, okay. Well, if there are no further questions, in the interest of being respectful of your time, like I said, you can use the QR code that was on the screen, or I see that Richard and Quincy have popped their email addresses in the chat. Please, please, please feel free to reach out, and we look forward to seeing you in our DNP program.
I
Have a
have a
great day.
question.
Oh, perfect. Yes, go
I'm
ahead.
I'm so sorry. I came in late. I didn't realize that. Sorry, I'm in the hospital. But when you start the DNP program, is it possible to take a let me say, is it possible for a hiatus if things change? The reason I'm asking is because I was hoping, or I am hoping, to do the companion DNP, because I've taken some of the I think two of the courses in my master's with my current program, and I was hoping to just continue. Um, I don't know, if is it possible that you can start and then take a hiatus while already in the program after boards, of course, or you have to finish it like
So yeah, so one of the things that we talked about was we no longer have a direct entry for companion students that we used to have in the past.
okay.
That was a very strategic move by us, because I'm all about data. So you will learn a lot about data in our DNP program. But when we looked at the data, we found that we were losing a lot of our companion students in the first couple of terms because they had competing priorities. They were learning to be a new nurse practitioner or a new midwife. And so then they couldn't get the same things done. And so we made the decision 2 years ago to discontinue the companion straight through program, because everybody was having to take off a break. So now the rules are you cannot continue straight through. You will finish
Okay.
whatever program you are in. You will go, you will take boards, and then you can apply for whatever rolling admission cycle is open at that time when
Okay.
you've completed your boards. But your application won't be considered complete until you have proof of that certification from your state and the national organization.
Okay, that makes sense. And sorry, I know I'm late,
Oh, don't be
but
sorry. We're here to answer your questions.
would you still consider, will it, the other courses that were taken prior, like with the master's program, will it still be considered in the DNP regardless of when I came in?
Yes, so
Okay.
not regardless of when you came in. We will accept any courses. So, currently students have done either PC 702, which is Epi and Biostats, PC 713, which is evidence-based practice, or PC 713, which was in Principles of Independent Practice, but is now called Fundamentals of Business and Finance and Advancing Healthcare. So if you took any of those three courses,
Yeah, I took two.
okay, so you took two of those courses. That means that those two courses that you took, I will accept them until the end of 2025. So if you start the DNP program by the end, so you need to start by the end fall 2025. Otherwise, starting winter 2026, we will not accept those courses and you'll have to redo them.
Oh, wow. I thought I had up until 2027. Okay.
Well, and I may have misspoken. You do have until 2027, meaning you have until the end of 2026. You are correct. 2027, they're not counted. So we're at the end of 2024. So you technically have all of next year,
Okay.
but you don't want to wait until the last minute. One of the things that we just talked about is whenever you're ready to submit your application, you actually don't want to wait until the application deadline to submit anything, because we have a rolling admissions process. So that means that if we have 150 apply, and I'll just make up a number. If we have 150 people apply and we have 50 seats, if 100 of them all submitted within the first 4 weeks of the application deadline, and they were all stellar students, then we're likely going to offer all those stellar students admission, right? So
Okay.
don't wait until the end of the deadline to apply.
Understood. Thank you so much.
You're welcome. And thank you for giving me the opportunity to clarify that date. Any other questions? All right. So as Quincy said, she will be sending out the recording of this to anybody here, and you can email her if you would like the recording. And you can always reach out to me if you have any further questions. So have a great day. Dr. Couch, anything?
No, thank you all for coming, and I'm looking forward to seeing each of you and DNP 850 pretty soon. Talk to you later.
Bye.